the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, July 14th, 2020, and we're going to get right into it. We have Dr. Edward Geiler, urologist with Urology Specialist Group. Dr. Geiler, how are you doing this evening?
Doing great. Thank you for having me.
And I can hear you loud and clear, and we're meeting and I can see you as well because we're on social media as well. But we're meeting for the first time right here on air, so I just want to make sure I have your last name right. It is Dr. Edward Geiler, correct?
That's correct.
Oh, I had the pronunciation right. So let's get right into it. So you're with besturologyclinic.com is the website. It's the Urology Specialist Group. You're an expert in erectile dysfunction, or as we know as ED, as the acronym. Can you elaborate on your expertise on ED and why, first your expertise and then why erectile dysfunction occurs?
Sure. I've been treating erectile dysfunction for over 22 years. I have a very big interest in it because I used to be an oncologist. I used to do a lot of cancer, and I used to do a lot of prostate removals. And one of the side effects of prostate removals is problems with your erection. And because of that, I wanted my patients not to have to suffer from it. And then I became an expert in putting penile implants. I trained with one of the best penile implanters in the world, Dr. C.B. in Detroit. And right now I do, the average urologist will do maybe 1 to 2 penile implants a year. And right now we're doing about 400. We actually, before COVID, we were in line to be doing 500 penile implants a year, which is among the top in the world. Erectile dysfunction. Go ahead.
Well, I was just going to say it went down with COVID, but 400 to 500 a year. That's just amazing. But go ahead. I didn't mean to interrupt you there.
No problem. Erectile dysfunction happens in older men, and is when a man is not able to obtain an erection that's satisfactory for him. So not necessarily you have erectile dysfunction when you can't have erections at all, but you can have, mild erectile dysfunction where, you just don't have the kind of sex that you want to have with your couple.
Of course, and it's Dr. Edward Geiler here. He's a urologist with the Urology Specialist Group. So Dr. Geiler, is there a common age that we can categorize in these type of men who suffer from ED or erectile dysfunction, or can it happen at any age?
I've seen men as young as 18 and 19 with erectile dysfunction problems, and I've seen men as old as 100 that are actually able to have sex. Obviously, as you get older, erectile dysfunction is more common. So as you get older, the most common age group that I see is anywhere between 60 to 70. That would be the most common age to have erectile dysfunction, but it's possible at any age. Obviously, the reasons for erectile dysfunction change with age.
Yeah, 60 to 70, and a little before that, that's the kind of time we're all, we should be concerned about our prostate and talking to our primary care as well as our urologist as well. I learned a lot in my research for this show, obviously, but I just wanted to share this with everyone and then get your opinion on as well. So I didn't know that erectile dysfunction could, be a physical condition caused by, issue with the prostate or prostate cancer or prostate removal, etc. Or it can be a psychological condition, which is really interesting. So you as a urologist, you have to determine and diagnose whether erectile dysfunction is caused by a physical or psychological condition?
Yes, absolutely. Luckily, studies have shown that even people that we used to think that had erectile dysfunction for psychological reasons, turns out to be that they have actually an organic reason to have it. And it's very common that people that have erectile dysfunction have depression and have psychological issues. Obviously, it's important to differentiate between the two, because if it's a psychological issue, by fixing the psychological issue, the erectile dysfunction improves on its own. What we commonly do is we have testing. We have testing in the office. We do ultrasounds of the penis and I try to diagnose the problem. So usually in people that have a medical problem of erectile dysfunction, we can identify a cause for it in the testing. And then once we find the cause of testing, it's easy to tell the patient, look, you can't get an erection because your arteries, they just don't dilate enough to get enough blood in your penis. And if it is a psychological issue, which is actually very rare, we will send them to a psychologist and have a psychologist help them psychologically. But at the same time, if you give them treatment for erectile dysfunction, the psychological issues tend to resolve much faster.
Very interesting. We're here with Dr. Edward Geiler, urologist with Urology Specialist Group. He just mentioned his office. The website is besturologyclinic.com. It's located at 2140 West 68th Street, Suite 200, Hialeah, 305-822-7227. And we'll give out that info many more times on this program. Dr. Geiler, what are some of the most common questions men ask you about penile implants? Obviously, before the procedure is done, I'm sure you get a ton of questions because it is a very unique specialty that you perform and care for as a doctor.
Yeah, absolutely. There's a lot of questions. The first thing that they ask is if they're walking naked in the gym, can anybody see that they have an implant in? Or if they're with a partner, can the partner know that they have a penile implant in? And I tell them it's totally invisible. It's completely inside their body, and you can't see anything. It's designed to simulate normal. The second thing that they ask is, does it change the sensation? Am I going to feel anything? Am I going to have an orgasm? Am I going to ejaculate? So what I tell them is that the feeling actually improves with a penile implant, because when your penis is flaccid, it's hard to feel. When it's hard and erect, it's much easier to feel. So usually the feeling and the sensations, they improve. The erections improve, and they can have orgasms and ejaculate. I had people I've implanted that were young, that once they had the implant, they were actually able to have babies because they were able to start having sex with their spouses. They're concerned about the procedure. I tell them, it's an outpatient procedure. It takes me about 15 to 20 minutes. Usually we recommend people stay out of work for 2 weeks, and then they're back to normal activity and normal sexual activity within 6 weeks after the surgery. The surgery is covered by 99.9% of all insurances. It's covered by Medicare. It's considered a treatment for erectile dysfunction, which is a disease. It's not considered a cosmetic procedure. Penile implants will not shrink your penis. They will not make your penis bigger. They're designed to make it hard. So I always laugh with my patients. I tell them, I make penises hard. God makes penises big. So it's not a penile enlargement procedure. It's just a function restoring procedure. The other thing that happens too is over the years, and I tell patients, the penis is like a muscle. So if you have a muscle and you don't use it, it shrinks away and it atrophies. So the same thing happens with erectile dysfunction. If you're not sexually active, your penis over time will shrink. And what happens is once we put the penile implants in place, it prevents the penis from further shrinking. Some patients with testosterone and activity actually will have their penises grow back to normal over the years, but it's the best way to prevent your penis from shrinking. And unfortunately, a lot of urologists, they treat the penile implant as a therapy of last resort, and they delay people from having their implants for so many years that they do have significant shrinkage. And in our practice, we're actually, once you fail the pills or you don't work very well with pills, we encourage people to have penile implants, and because of that, we kind of use the longer spectrum of the penile implants. Actually, we did 6 cases today at Palmetto, and the rep was saying that we use the longest in the country. So I think that if you're having erectile dysfunction and the pills are not working, don't wait, because the longer you wait, the smaller your penis is going to get, and the smaller implant that you will receive. So I think by us being very aggressive and encouraging people to have implants, and not only can they resume with their lives and they can, not get divorced and keep their spouses happy, but they benefit from having the largest implants as opposed to having implanted small.
Fascinating talk we're having here with Dr. Edward Geiler, urologist with Urology Specialist Group. Dr. Geiler, hold that thought. Stay right there. We're going to take a quick commercial break. And on the other side, we're going to talk a little bit more about penile implants and endourology as well, another area of interest of Dr. Geiler's on the You and Your Doctor show. We'll be right back.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. In your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. Yeah, if you got any questions, call in quick, 1-888-565-1470. We got Dr. Geiler for about next 10 minutes. Dr. Geiler, again, Dr. Edward Geiler, urologist with Urology Specialist Group. BestUrologyClinic.com is the website. The number is 305-822-7227. Dr. Geiler, did I hear that correctly? With penile implants, the procedure is only about 15 to 20 minutes. Did I hear that correctly?
Yes, in our hands, it takes 15 to 20 minutes. If you go to other people, it can take 2 to 3 hours. But, I have over 5,000 implants done. I have my own technique that I use, and we kind of perfected it over the years. In an international training center, I train urologists from all over the world on how to do penile implants, and I operate all over the world. So yeah, we have our own technique, and the advantage of doing things quickly is infection. You know, the faster you operate, the lower incidence of infection, and we have the lowest incidence of infection of penile implants in the world. Also, there's less inflammation, there's less swelling, and the patients have much less pain through the procedure. A lot of our patients don't even take a pain pill after surgery. So we're very proud of our results. Yeah.
I was just going to ask you about that, about pain, and that is terrific. Yeah, not much, pain after surgery. Some cases not even the need for a pain pill. Are you able to explain a little bit about how the penile implant you perform works? Because I was wondering, is the pump? I mean, how does it actually perform? The erection.
Exactly, it's a hydraulic mechanism, so it's powered by water. So what we do is we implant a reservoir that has water in it. It goes in the abdomen. Then there's 2 cylinders that go in the penis, and there's a pump in the scrotum. So when you want to have sex, you squeeze the pump, and it moves fluid from the reservoir to the cylinders. And the cylinders get hard, and they actually kind of go up like a normal erection. We would like, to be standing up as much as possible. And then the patient has sexual relations, and he controls it. It's not like a normal erection where when you ejaculate, it doesn't go down. So if patients have problems with premature ejaculation, they can train themselves to keep the implant up and continue having sex, thereby making sure that their partners are always satisfied. Problems that us normal people have, Then when they decide that they don't want to have sex anymore, it has a button. It's a quick release button. They press it, and then it opens up the valve, and the fluid goes from the cylinders back into the reservoir. So it kind of mimics a natural erection. It goes up and down. There are other types of implants. There's 2-piece implants, and then there's semi-rigid implants. Those mostly are used by people that are fairly inexperienced with implants, and they're not as good as the 3-piece implants because they can't move as much fluid, and it's basically a compromise for people that don't have a lot of experience implanting. But because we have so much experience, we can always implant the best for everybody. So I exclusively use the 3-piece implant, which is it's the best, basically.
Amazing. Is there a referral process, or can men who are interested connect with you right at besturologyclinic.com, request an appointment, or do they have to talk to their primary care, etc.?
No, I mean, most of our patients, they come from word to mouth. We have a lot of satisfied people. There's some medical doctors that know that we exist. I've actually put implants in a lot of doctors in town, and they're so happy that they send the patients in. But you can just come in if you want an implant. Obviously, if your insurance requires a referral, you need to talk to your doctor and get a referral to see us. But we take all the HMOs. It shouldn't be much of an issue for them. And a lot of the urologists in town actually already know me, and they actually will send me the patients in their practice that want implants for me to put them in. Because it's, implants is a special thing where you want just a few very experienced people to put it. You don't want patients having 1 or 2, implants with people that only do 1 or 2 a year. We really want to make sure that patients have a good results and good experience with implants, because that's the only way that you can, we as urologists think everybody knows what an implant is, but the more that I talk to people, the more I realize that people out there, they don't really know. And it's a great option for diabetics in implants, people that have heart disease. I mean, we don't treat patients that are healthy. Our patients are very sick and have heart attacks and strokes, and they just want to have a normal life. And even in the most complicated and most difficult patients, we rarely ever have an issue with them during surgery. And it's a very, very safe procedure.
Yeah, we always talk about doing this show for 5 years. We always talk about, doctors and how they can help people with quality of life. And this is definitely a quality of life, thing for men to pursue. So I think it's fantastic, and I'm so happy to hear about, all the stories that you've told about men, and even the men that, have started a family because of this. That's really neat as well, and it's great.
Yeah,
it's quality of life.
I had a patient last week. I wanted to tell you the story because it was very impactful for me. So he's an older guy, and his wife, she was going to leave him because he couldn't perform. So he came by, and I did an implant on him about half a year ago. And then he came to see me for his follow-up, and the guy is happy. And he was like, "Doc, you're not going to believe it." I'm like, "What?" He goes, "She was going to leave me. Now I walk out of the house, and she's jealous." I'm like, "I'm 70 years old. I have a 50-year-old wife, and she's jealous of me." I'm like, "Oh my God." I thought that was amazing.
Yeah, things have changed. Definitely. That is great. Great story as well. Let's talk a little bit about your other areas of interest. Well, first of all, I just want to mention also you do your these penile implant surgeries at Palmetto General Hospital there in Hialeah, correct?
Yes, absolutely. Palmetto and Coral Gables. That's where we do
Coral
most
Gables
of our-
Hospital.
Yeah.
Okay, I just wanted to mention that. All right, so if anyone, needs to, find out a little bit more about penile implants, again, it's besturologyclinic.com, 305-822-7227. Let's talk a little bit about your other areas of interest. Endourology, what is that, and how can you help people with, that type of care?
Endourology basically means treatment surgery through cameras. And basically, what we do there is we do prostate. We shrink prostates with laser. We use the green light technology we have at Palmetto Hospital. And basically, if you can't pee and you have an enlarged prostate, is a way to, under an hour with an outpatient surgical procedure, resolve the problem permanently. The treatment is effective, 95% of the time, and the problem is cured. Usually, prostates will grow back 10 to 15 years later. So it's a very, very effective treatment. It's one of the most effective treatments in the market, and we do a lot of green lights. We also use endourology to treat kidney stones. So I'm a specialist in kidney stones, whether they're in the kidney, in the ureter, or in the bladder. And I also do percutaneous surgery, which is not a lot of people do. But once the kidney stones are very large and you can't shock them with a shock wave because they're just too big, then we go with a camera through the back into the kidney and we grind the stones and we suck the stones out. So one of the few doctors around that knows how to do that procedure very well, and we've done a lot of them. We have all the newest equipment at Palmetto General Hospital. The nice thing about Palmetto is that over the years, I've been there for so long, and I'm so busy, I have so many cases that they're really invested in equipment. So they have all the latest scopes and they have all the best equipment. And we just got the brand new machine to remove kidney stones. And we can actually do the procedure 3 times faster than we used to be able to do it. So very happy with the hospital.
Yeah, that's great news for men. And that hospital is palmettogeneral.com. You also perform, you can perform procedures right in your office as well with Urology Specialist Group, correct? We have about less than a minute, so.
Yeah, we have a new treatment for prostate cancer that we can actually do in the office. We're actually treating and curing prostate cancer in the office. We're probably the only people in the world that are capable of doing that right now. So if you have an elevated PSA, abnormal rectal exam of prostate cancer, I would recommend you have CS before you have radiation after it. You can avoid you having radiation with a quick treatment in the office.
Well, Dr. Geiler, we'll have to have you on again soon because this was a fascinating program. I'd love to have you on again if you can come on.
Anytime you want.
Thank you again. It's Dr. Edward Geiler, Urology Specialist Group, besturologyclinic.com, 305-822-7227. Thanks, Dr. Geiler. We'll see everyone next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living